Hey, we're Team Aowkin, working on a sickle cell disease patient app. We are working on a consulting project for the London Hematology Clinic, collaborating with fourth-year resident Eric Toe and Dr. Sol. We formed the initial relationship through a UW organization, KWSIM, whose mission is to connect engineers with medical students.
The problem we are working on is managing sickle cell disease, or SCD. SCD is a red blood cell disorder which results in sickling of red blood cells as shown here and leads to many complications. It is a chronic disease that requires specialist and multidisciplinary medical care. Patients with SCD often minimize or underestimate their symptoms. Further, clinicians only see patients every 3 to 6 months and thus only have this one data point on how the patient is doing. This leads to suboptimal treatment.
The solution that we have come up with is a companion mobile app for patients that allow them to track daily health metrics and pain crisis incidents. Patients will be able to export their health data into a standard format that can easily be shared with their primary healthcare provider during an appointment. This is a richer source of data for physicians and will lead to better outcomes for the patient. The app will also allow the user to quickly access resources such as links to support groups and information about their medications and symptoms. So far, we have completed an MVP product scope, a Figma design prototype, and some boilerplate code.
Let's take a look at the Figma. When the patient opens the app, they are greeted with a welcome screen that contains an overview of the reports they have completed. Two of the main reports that a patient will create are 1. A daily diary report about how they were feeling that day, their medication compliance, and other SCD-specific details. And 2. A pain crisis report. Patients often suffer from sickle cell crises, which are periods of pain that vary in intensity and duration. Following the episode, the patient will record things like how intense the pain was, where they felt it, what medication they took, and other details. These reports can be seen on the history page and also exported as a summary to be shared with their primary healthcare provider. The app also has a resources tab for static information and a passport page that presents a digital patient card that can be shown during an ER visit. The patient will also receive periodic notifications to help them remember to complete these reports. Our solution is cross-platform, built using React Native, and will support both Android and iOS devices. The app will give patients full control over the ownership of their data, where sharing reports is explicitly initiated by the patient.
Next, a peek into our process. We have 2 meetings per week as a team, with an additional meeting per week with our stakeholders. Internally, we use Notion as our knowledge base and Messenger as our communication tool. And for our stakeholders, we use Google Drive and WhatsApp. Through MP2, we've had many key takeaways. We learned that having a consultee to obtain feedback is very helpful for building a solution that solves the user problem. The stakeholders were very responsive throughout the milestone, and we look forward to getting access to user interviews with their help in milestone 3. One of the things we want to improve is having a consistent design system, so that we can more effectively iterate on the UI and UX of the app.
Healthcare is a critical part of our society. There has never been more opportunity to work on problems in the world of healthcare. We are Team Aowkin, and it's time to build.